All right, welcome back. We got this week's edition of Doc Talks. We are going to be talking elbow, tennis elbow, to be specific, tennis elbow one-on-one. This is pretty common in a lot of rotational athletes, pretty common in people that have a lot of gripping sports, so racket sports, whether it's golf, obviously tennis. What else we got for racket sports? Ping pong.
Makes me think of Forrest Gump. Yeah. Hey. I want to play some ping pong. Yeah, golf. But I've also seen it in, things like swimming.
Weightlifters.
Weightlifters.
All sorts of stuff. So, definitely anything that requires a lot of grip.
Yes. Hitting your arm on a door. I've gotten tennis elbow from doing that. So any trauma to this.
So do you think it was classic tennis elbow at that point?
We'll talk afterwards, but I think there was definitely some contributing factors.
Or we'll go through what classic and non-classic would potentially be, right?
We will, yes.
Okay.
Stay tuned.
So we will be going through some of that. What is a true tennis elbow in its like an actual diagnosis and what it isn't, and then things to look for that are potential factors that could be causing this, and then some things that we've done while treating a patient with either a classic or a non-classic type of tennis elbow. So tennis elbow, what is it? Typically, if you look at medical diagnosis of tennis elbow, it would be tendinitis at the elbow, of the extensor tendons of the elbow. So extensors are all these muscles that create this motion in the elbow, or this motion at the wrist. But those muscles, they all have tendons that go down into the wrist, and they pull on all these little bones and even the fingers, and they all come up to a common tendon in the back of the elbow. Yes. And then it can create pain with being overuse, or having like some really big high stress injuries to those areas. So there can be tears. There can be just irritations of the tendon, and I guess that kind of goes into how much grading we want to talk about. Is there an actual tear, grade 1, 2, 3? We talk about all that kind of stuff. But classically, it's an itis. Itis meaning, so if you guys have heard of arthritis, or tendinitis is another one that's really common for areas of the body. It's inflammatory process, or something that's inflamed, and whatever the word is before that. So a tendinitis, tendon inflammation. We got same thing, lateral epicondylitis. So something that is irritated at the lateral epicondyle. That's the bone at the elbow that's a little bit inflamed.
Yeah, and the key with that, and when we're talking about classic tennis elbow or classic lateral epicondylitis, is there's an inflammatory response occurring. So a lot of times, if you have classic, and believe it or not, it's probably a little bit less uncommon than you would think, you'll see swelling in that part of your forearm. So it might appear a little bit bigger, it might have some redness in that area, it might be a little sensitive to the touch. And that alone doesn't mean you have, if you're like, oh, that's sore here, that doesn't mean it's necessarily inflamed. You need those other symptoms that correspond with that. Because if you do have that, especially after an initial injury, there's things you need to do to treat that would be different than maybe some of the stuff that we do here, even though we can help you in that instance, but there's other options that you can have as well.
Yeah, so classic versus and not classic. Maybe a non-classic would be something that is starting in another location of your body, but we're seeing pain at the elbow. That's very, very typical for us to end up finding that there's other contributing factors, and that it isn't necessarily a swelling process or inflammatory process going on at the elbow. We can see neck, shoulder, wrist. We can go as far as into the upper back that could potentially be playing into this being an issue later on, especially with a rotational athlete or someone that's going to be doing something that has like a whip-like action. If one part is doing all of the whipping, it's probably going to end up being some sort of dysfunction there. And then before we move away from like classic, this is something that I've seen in some clinical cases is lateral epicondylitis can actually turn into like an apophysitis, meaning, or like it's like a tearing of the tendon, actually ripping away from the bone, or irritating at the bone. And if that's the case, that's usually, I'd say, more in like a youth athlete that is, doing a lot of swinging, a lot of reps, a lot of something where they're whipping the wrist. That can be a little bit more detrimental long term, because it takes a little bit more time to get the bone to fuse and mend and that kind of stuff.
Mm-hmm. Yeah. And usually with something like that, or if you've had any injury where there's tearing, generally there's a loss of your ability to straighten the elbow in that case. Or if you have a severe loss of motion, it probably warrants getting checked out, because you might have something that's a little bit more undesirable to have, because usually tennis elbow is very, very treatable. Whereas other stuff may require things that a chiropractor and physical therapist may not be able to help you with.
Yeah, definitely getting that type of stuff evaluated and making sure you're going down the right road right from the get-go, pretty important. So things that it isn't, we talked a little bit about, sometimes there isn't actual inflammatory processes going on there. If this has happened a lot, so you get chronic flare-up of something on the outside of the elbow, the more that you actually insult the tissue or irritate the tissue, the body might not respond with the same inflammatory reactions. So we'll have something that constantly gets irritated over and over and over again. The body's just like, you know what? I'm not going to even inflame it, because it hasn't done anything so far. So there's not going to be a big inflammatory reaction. So if you maybe had classic in the beginning and it was swollen and it stays around because you've done the same thing over and over again and irritated a bunch, you could have a classic, but it's just kind of morphed into one that just doesn't inflame that much. Or when we're going to talk about later, there might be some other areas that are potentially leading to that long-standing pain.
Yeah, and a lot of times that we especially see that too in cases that have been going on for a long period of time, or you get on again, off again symptoms periodically throughout your lifespan. There can be local changes that happen in the tissues themselves, just like, if there's a tendon issue anywhere else in the body. Sometimes people get sore Achilles, or they get another sore, or thank you, patellar tendon.
Yeah.
I had to think about my tendons.
That's a big one.
And so the treatment just changes a little bit differently based on that. But regardless, with something like this, if you're getting pain here, the evaluation and the treatment program should be very comprehensive to look at a lot of things, because there's actually some research out there showing even if you had a local issue at your elbow, regardless of if there's neck involvement or not, doing things to improve neck range of motion can help that.
Oh yeah.
It's actually cool, let's say, because they did manipulations or adjustments, depending on what your letters are.
Hey. I'll do manipulations if you want. I don't care. Same thing.
Well, I won't adjust because I get in trouble. But they did whatever type of treatment that was, manipulation, adjustment, to people who had no findings in their neck, and it still led to significant improvements in elbow symptoms. So it just goes to show you how you need to find someone if you're dealing with this, and you can't, the stuff that we give you to help you out can't get you over the hump. Sometimes getting a comprehensive evaluation of you and how you move, that can be the difference between feeling better and being stuck where you're at.
Yeah, so that leads us into looking at some of the other factors that go along with this type of symptom, or this type of tissue irritation. Looking local, and then looking at peripheral, meaning stuff that's not just here. If this is where the pain actually shows up, most of the time there's going to be other things that contribute. We talked a little bit about like the local tissues, the tendons, the ligaments, the bones in this area, and the muscles. And then looking at the rest of the chain. So kinetic chain, meaning all the way down at the wrist, up at the shoulder, up at the neck. There's something that's called double crush syndrome, and this is something that it can happen, and it's more of a concept than it is a syndrome, in my understanding. But double crush meaning there's an irritation somewhere along this chain, and then there may be another irritation somewhere along the chain, and then it finally shows up as pain somewhere else. So tissue gets irritated up at my neck, tissue gets irritated at my shoulder, and then it's like, this is actually, it doesn't even have any tissue irritation, but this stuff is actually contributing to the pain and causing pain to show up down here. So going back to what you said, getting that a big evaluation on stuff. If you're not getting results with local treatment, we need to start looking at other areas, especially up in the neck and the shoulder. They're all very, very well connected. They have a lot of crosstalk between each other.
Yeah. Absolutely.
Yeah.
I think that's perfect. Now, you're probably wondering, okay, this is all well and good. What the heck do we do about our elbow? It's still hurting even after we've explained what's going on to you. Well, we're glad that you asked, because there's a lot of different things that we can do treatment-wise that can improve this area. If we start with local stuff first, because let's say you're that person who does have a little bit of swelling, and you do have some of that local soreness and sensitivity. One of the easiest things you can do to help manage or reduce symptoms pretty much quickly is isometrics. That's one of the first line treatments that we do anytime someone has any tendon issues. So all you got to do, I always tell these people, if it's your right elbow, you're going to take the throttle of the bike. Actually, this would be the clutch, right? No.
That's gas.
Throttle. Okay, you're going to throttle the bike, and then you're going to gently press down on your wrist. So I'm trying to push down this way, but I'm going to resist the urge. Here like this. You'll feel this working a little bit, but it shouldn't hurt. And you're going to hold this for up to 30 seconds. You're going to get tired. It's going to be lovely. But if you do about 6 rounds of that, a lot of times that can reduce some soreness in the short term. So you go 30 seconds, rest 30, 30, rest 30. Now you're like, wow, time is going so fast. It does go by fast on these doc talks. But that's a good starting point just to reduce symptoms in the short term.
Yeah, absolutely. Yeah, I mean, that's a good starting point. And you can play with different positions at the wrist, and you can play with what's called supination and pronation at the wrist. You can do certain things differently to target maybe a tissue that feels like it's a little bit more sensitive, and then we try to build that sensitivity in the opposite direction. We try to start making it less sensitive with these isometric contractions. And since that's not something that is necessarily like fatiguing, like long term, in the moment it'll probably be fatiguing. That can be continually done. You can keep on working on that stuff later the next day. You can be pretty consistent with some of that stuff. So I'll typically tell them if it's not flared up or really irritated, keep on doing those things daily, because you're constantly just getting your body to recognize contraction doesn't always mean pain, and that's what you want. You want to reinforce that as quickly as possible so that when you get out to swinging that stuff again, it doesn't create pain every time that you contract that muscle. Yeah,
especially if you've laid off of your sport for a period of time because you're hurting. If you don't do things to bridge the gap from, okay, I haven't been doing any activity and now I'm going to go play tennis for 2 hours, well, you're probably going to end up back to square one because your tissues have just lost their conditioning. You've gotten out of shape, so to speak. It's just like if you don't run for 6 months, you probably shouldn't go back to the mileage that you were doing beforehand or run the marathon on the first day. Same principle applies to this. These isometric holds, or where you're just giving a little bit of pressure, help start building some load tolerance in that area that has probably become a little bit deconditioned.
Yeah, and don't be afraid of mild pains with that. Mild pains meaning on a scale of 1 to 10, if we're in the 2s, 3s, maybe a 4. Those are something that our body can usually handle. If we can keep on dropping that down, or we stay around that over time, I think that will go down. I don't think it's necessarily going to go up, depending on how much you can handle pain. If you're like Zach, he's a very tough hombre, and his 4 is not my 4. But it's a general suggestion, trying to keep around your 3 or a 4. And if you see the trend start to go in the bad direction, you keep on seeing like a 3, 4, and then a 5, and then a 6 on the next day. That means you're going too hard, so let's drop that back down.
Yep.
Pretty easy to guide where you're going with how much pressure, just giving yourself a grade on your 3 to 4 out of 10.
Yeah, spot on.
And then, so next, when we talked about assessment, looking at some of the other areas. So typically, if this is like caused from a racket type sport or a club type sport, and we're starting to get these pains, there's a lot that goes into that, meaning the neck, shoulder, elbow, wrist. So with the head, so if I can actually get more range of motion in one of the directions that I'm trying to play my sport in, now I don't have to finish quite as hard on my wrist extension potentially. Or if my shoulder can't do this motion, that's not good for the elbow or the wrist, because what has to happen, you have to accelerate the club or the paddle or the racket a little bit more with the wrist. So knowing where your limitations are, whether it be neck, shoulder, elbow, wrist, just know that one of those things, if they're not doing their responsibility, something else is going to have to start picking it up. And a lot of times we'll end up flicking the wrist really, really hard, and that's what can cause a little bit of overuse or extra tensions across some of the outside of the elbow.
Yeah, for sure. And your first line of defense, oftentimes after you reduce symptoms, is to improve those areas first, because your elbow, its range of motion is influenced by what happens here. You know, it's not like this hingy joint. There's actually rotations that happen at your elbow as you bend and straighten it. So if you don't have rotational capabilities at your shoulder, that can negatively influence what's going on at your elbow. One of my favorite moves, if you're one of those people who has a hard time getting the backswing, or this motion's limited, you can't give good high fives, is putting your elbows on your knees, pushing your chest away, and then if you turn your arms out a little bit and you breathe in this position, to get it right, you'll get a nice upper back stretch. That could be a great way to help restore mechanics to go into that position.
Yeah, I'm sure that helps with scapular mechanics or shoulder blade mechanics.
Absolutely.
Getting that stuff to help with positioning the glenohumeral joint, or this joint that moves at where the humerus and the shoulder blade connect. That gets into a better position where it allows more ranges of motion at the shoulder.
Yeah.
So,
and if you have neck restrictions too, it's nice because you're getting that stretch in your upper back, and when you turn your head and your neck, you also get some movements in your upper back as you're doing that. So it's kind of a nice catch-all for all those areas. And
yeah.
I'll link a more in-depth video of that in the show notes. I might actually have some, we might have a doc talk where we had a single arm version, or not doc talk, but a Therapy Tuesday one where you have a single leg version, or a single arm version of that.
Yeah,
but I think it's single leg as well.
And then another thing to look at, this is when we're actually treating these types of cases, there's a couple of tissues that are not just, the bicep goes from here to here, and then the wrist flexors go from here to here. There's other tissues that actually go really, really long from the spine all the way out to the fingertips. There's two, fascia. Not a lot of people know about fascia. Some people do, some people don't. And then there's neurologic tissue or nerves. So what we tend to see is if there has been insult to tissue locally, and it potentially doesn't allow the nerves to slide and glide very well, we like to look at what's called neurodynamics. So just like what Zach was saying, something that helps maybe restore a motion, this actually helps the nerves restore a little bit of motion. So neurodynamics, there's a nerve goes from the neck, goes down through the arm, and it starts to sprout out right through the back portion of the elbow, really close to where the extensor tendons that we first started talking about. That's right where those are at, and it goes right through a muscle. So obviously we want to evaluate to see if that muscle's doing well. But in addition to that, if we have a test and we see that this nerve is entrapped or it doesn't function very well with different stresses and movements, we can go through what's called neurodynamics. So this is a good one for what's called a radial nerve. That's this nerve that we're talking about, radial nerve neurodynamics, acting like you're trying to get a tip from someone. So, hey, Zach, getting a tip and extending at the elbow, letting the shoulder drop, and then reaching back behind. And then if he's really not giving my tip and I'm starting to walk away, you can extend a little bit here too. That can increase a little bit of tension, but we have to make sure that our head involved as well. So as this goes into a stretch, or I'm trying to pull that nerve this way, I want to make sure my head actually tilts this way. So it allows that nerve to drop down and be pulled that way. So if we're pulling down this way with my hand being back behind me, that actually gets the the nerve to slide down this way, but we want to make sure it can, and we're not just pulling on both sides of the nerves, because that does not do well for nerves. They don't like being pulled on each direction. So here, and then all the way back up. Here, and all the way back up. It's really, really easy to do, but if you're getting around 12 to 15 reps of that a couple of times throughout the day, you're at least getting that nerve to hopefully get a little bit more freedoms along the chain there.
Yep, yeah, and a lot of times I like pairing that with the isometric afterwards, because a lot of times your nerves are supposed to move, and sometimes if there's a loss of movement because of some of the stuff that we've talked about, they can get sensitive. So anytime you're introducing some gentle movement into that region, it can reduce sensitivity, and a lot of times will help people feel good and be able to do a lot of the things that they want to do very quickly.
Yeah, because I mean, right when you introduce a contraction in there, if it's at a lower state of sensitive, like it's not like, oh crap, anytime that this is moved, it's painful. Now we have a little bit harder contraction. You know, a little bit harder contraction means probably a little bit more stimulus into the area, a little bit more resiliency being taken long term. So 2 moves. Definitely getting the shoulder to have a little bit more external rotation, because one, when we're reaching for more external rotation with a club sport, racket sport, the wrist tries to take over some of the external rotation that's lost, and it'll just chew up the outside of the elbow. So we need to make sure our shoulder gets as much external rotation as possible. And then 2, if we have a ticked off nerve anywhere along this chain, if we start flossing it and giving it an environment that feels a little bit more easy to move, it'll probably be a good thing for pain at the areas that we're talking about at the outside of the elbow.
Yeah. Perfect.
Cool. So just to recap, looking at classic versus non-classic, I guess. Looking at a swelling, if that actually is occurring, you probably have a little bit more of the classic case potentially. You obviously need to get a diagnosis on that. But it doesn't always have to be swelling to be typical tennis elbow. Looking at the whole kinetic chain, that's a big one. Looking at local tissues versus peripheral tissues, the neck being one of those. And then looking at treatment factors of trying to see if we can increase the abilities in other joints.
Yep, spot on. And then just making sure that you're doing everything that you can to get all those areas moving well and feeling well, and a lot of times that can clear up symptoms.
Yeah.
If it doesn't, or you're getting a little bit of benefit and you want a little bit of more, call 702-558-2151, because we can help give you some streamlined things that can help you manage some of the stuff that you're dealing with. Because while we can give general recommendations, Kyle is built different from me and is built different from Dr. Wood in the back. So we might need different treatments, even if we all played a lot of tennis one weekend and got pretty sore and stiff.
And even if it was a loss of what's the shoulder motion that we're talking about, my intervention might be different than Zach's intervention. Like we might need different things. So we gave one example of these movements. There's a lot more examples. Obviously, we just got to figure out which one's right for the patient that's in front of us. So if this doesn't work for you, or if you need some more answers, reach out to us.
Yeah, and we'd be happy to hop on. We do discovery sessions here at Elevate Sports Performance and Healthcare. If you're just like, I'm not sure what I need to do, don't hesitate to call us and drop in, and we'll chat with you for free, and we'll get you taken care of, even if it's not with us. Yep,
discovery sessions are a good way to figure out if we can help you. So reach out if you need us, and we will give you our best suggestions.
Yep.
Cool.
Do we have any questions from anybody? No? All right. All right, well, we will wave away to you as well, and we'll see you next week for Doc Talk episode. It's probably like 16, 17. I don't know. We've been doing this for a hot minute.
We're getting after it. We are getting after it.
We appreciate you tuning in.
See you guys.